to provide a safe and healthy working environment. So what does that mean? It means plant, systems of work, which is super important, handling, storage or transport of plant or substances, adequate facilities, and of course, information, instruction, training and supervision. That's under section 21. Then we have other duties as well. Monitoring the health of employees, monitoring the conditions of the workplace, providing OHS information in other languages, keeping information and records relating to employees' health and safety, employing or engaging suitably qualified persons to provide advice, as well as duties to other persons and duties in relation to the workplace and the entry-exit. So if we look at that, we see that, for example, it is clear monitoring the health of employees. That includes the psychological health. So as Dominic said, the duties of employers in terms of providing a working environment that is healthy and without risks, safe and without risk to health, have always covered psychological health.
But what are we missing here? There's one thing that we need to talk about before we move on. I can hear everyone yelling it through the muted buttons.
And of course, that is the duty to consult, which, you know, we harp on about, and this is why we have people like you in workplaces. And that is that the employer has a legal duty to consult with HSRs on many things, in fact, on all things that can affect the health and safety of their members. So when identifying or assessing hazards and risks, when making decisions about controlling them, on the types of facilities, on procedures like resolving issues and monitoring health, on committees, and when, of course, proposing any changes to the workplace, the plant, the substances, or the conduct of work. A super important duty that we know that you know all about, but we sometimes doubt whether employers actually understand it.
I think it's often referred to as the most breached section of the Occupational Health and Safety Act. I would remind HSRs as well, you're all familiar with section 35, I'm sure, but regulation 21 goes into more detail about how to involve HSRs in consultation. And what that says is, unless it's not reasonably practicable to do so, the employer needs to provide the information to the health and safety representative a reasonable time before providing the information to the employees. So not only should you usually, in most situations, be getting this information, you should also be getting it before they go out and give it to employees more generally. So I wanted to, before we move on, just talk a bit about why this is proven, all these powers, all these duties have proven inadequate for dealing with psychological health. There's always been a duty to provide, but why have employees been historically so bad at it? The duty to provide a safe workplace is always qualified by the words reasonably practicable. So section 20 defines reasonably practicable. We're not going to look at that now, but basically it's necessary to eliminate, and if that's not possible, reduce. But there's no reference to the hierarchy of controls there. It's really easy, I think, for employers to fix a trip hazard or some other obvious physical hazard in the workplace. Make sure everyone's wearing high vis, for example, is another control that's pretty easy to maybe not the best example in terms of the hierarchy, but certainly an easy control to enforce. But how are you supposed to deal with workers' mental health? Employers have struggled with this, and I think, you know, all the evidence goes to point to that. As a result, a lot of employers default to consultants and controls that do not actually tackle the underlying hazards. So yoga, mindfulness training, it places the obligation back on the individual rather than tackling the underlying work-related factors that are causing the hazard. And from Renata's reaction, you can see what we think here of mindfulness training as a proper control.
Yeah, it's sort of like a virtual PP, virtual hard hat. So it's the lowest order and it doesn't actually look at the causes. I have to go back in my decades of being in health and safety. And I remember employer organisations around the table at what was then NOSH, which is now Safe Work Australia, actually saying that this wasn't their issue, that if employees were stressed, it was because they had problems at home. So we've moved them along a little bit, but it's still hard to get them to address what's really important.
I think there are some still employers or employer organisations as well that still hold that view, Renata, unfortunately. Yes, putting things back on the individual, it's the individual factors, and then abrogating themselves of the responsibility to identify and control work-related factors. I mean, the results speak for themselves. The number and rate of psychological injuries in Victoria, and for that matter, in Australia, increase every year. 16% of all new claims are psychological injuries, and psychological injuries, people who suffer a psychological injury are less likely to return to their pre-injury duties and employment. And when they do, it does take longer. So at the 26-week mark, for example, 42% of people who've suffered a mental injury have returned to their pre-injury duties, compared to 73% for physical injuries. There's a really big gap there.
And I think that can be partly explained by the fact that it probably takes longer for someone to actually put in a work cover claim when they have this sort of an injury. They try to cope. And by the time they do, and it gets accepted, they're well down the track of having a very serious injury.
Well, that's a good point. Those are work cover claims that are accepted, let alone all the mental health claims that aren't accepted, because because there is a fault element in accepting those work cover claims compared to other types of claims. Physical claims. Look, why should we do something about it? I mean, the first reason is compassionate. Workers deserve to have healthy lives, and employers need to send their workers home safe and healthy, and that includes psychologically healthy.
Particularly if what's making them sick is work-related.
I mean, there's another reason to act as well, and it comes down to dollars and cents. The work cover scheme is essentially an insurance scheme, and when claims go up and people are staying off work for longer, it's costing more and more money, and these things make a scheme unviable if they're not addressed. And it's much better to try and address it at the point of stopping people get injured.
Exactly.
So as a result of that, BTHC and your unions have been campaigning for change. There's been extensive lobbying from unions, HSRs and workers, and there's a couple of examples there. The Risks to Psychological Health conference we did a couple of years ago. I'm sure many of you would have attended that. And in fact, Associate Professor Maureen Dollard, who spoke at that conference, her ideas have been quite influential on the regulations as they've shaped out. So if you are interested in what she has to say, check that out online. There's been all manner of government reviews, most famously the Royal Commission to Victoria's mental health system. There's been other reviews as well, the Boland review into the WHS laws, which nevertheless have had a lot of influence in Victoria, and our petitions as well. So as you can see, we've run petitions calling for mentally safe workplaces. I think it's important to recognise there's a lot of momentum to do more in this area, but that momentum's come about because of union activism and HSRs and workers speaking up.
And can I say, as usual, because particularly with government, they have to be pushed. When we have Labor governments, they're more likely to respond to unions. Unfortunately, the Conservatives don't even want to talk to us. But often the sorts of reforms that we've seen in occupational health and safety, even back to the introduction of the Health and Safety Act in 1985, was in fact due to union lobbying and members and the sort of work that we've done. So that's fabulous.
Fantastic. Next slide.
Okay, so here we have the proposed psychological health regulations. Last year, the Victorian government announced that they would introduce these new regulations specifically to address psychological hazards in the workplace. Now, what I find amazing is that they came up for public comment. They are open for public comment until the 31st of March, and the government has committed to a commencement date of the 1st of July, 2022. So this is this year. This is very quick. Which is fabulous, because I think once a decision is made, we go ahead and do it. As Dom has stressed, it's really nothing really new. There are no new duties in terms of the general duty of care, but they're much more specific, and there are 4 main sections in the Act, which we're going to go through in the regs, sorry. Yeah. Okay, so we have the definitions. What is a psychosocial hazard? Now you'll notice that we say it's psychological health, but the hazards are psychosocial hazards. It gets me in a bit of a tiz as well. So a psychosocial hazard means any factor or factors in the work design or the systems of work or the management of work or the carrying out of work or the personal or work-related interactions that may arise in the working environment and may cause an employee to experience one or more negative psychological responses that create a risk to their health and safety. Now, we've got a couple of issues here, and we've highlighted them in red. One of them...
There's one we haven't highlighted as well.
There's 3. Working environment, while it's mentioned at the bottom, it doesn't talk about the working environment. So we know that continual noise or really high temperatures, which are part of the physical working environment, don't actually fit under A to E. So we've made that comment. The second one is that negative. Anyone who has a psychological response, whether it's negative or positive, people say there's positive stress, whether it's negative or positive, the mere fact that we're reacting can have a negative effect on our health. So it shouldn't be negative. And the final thing there is it says a risk to their health and safety. It should be a risk to their health or safety. So there are the three things in the definitions that we picked up.
Well, just in the definition of psychosocial hazard.
Yes.
And it's important, this is, you know, this is the exposure draft. This is going out for public consultation. BTHC will be providing feedback, and this is some of the feedback we'll be providing.
Okay, so underneath the definition, WorkSafe in the proposed regs has actually listed a number of examples. So you can see that there are lots there. Bullying, sexual harassment, aggression or violence, exposure to traumatic events or content, high job demands, low job control, poor support, poor organisational justice, low role clarity, poor environmental conditions, so they've picked it up here, remote or isolated work, poor organisational change management, low recognition and reward, poor workplace relationships. So that's what we've got there at the moment.
Yeah, it's important to note that the way the regulations are drafted is they're designed to pick up any psychosocial hazard, not just the listed examples. These are just examples. Yet nevertheless, things missing from the list is still, we think, a problem. And that is because having it in the list makes it that much easier for you as HSRs to establish that there is a hazard in the workplace that is a psychosocial hazard.
And it's listed in the regulation.
And it's listed in the regs. So the second thing is there will be a compliance code, which we'll speak a bit more about in a bit, but that compliance code takes these listed examples and expands them and gives further examples and more detail.
And what to do and what and so on.
So getting examples, listed examples into the regs is really important. So we think in particular, there are three things that should be added. The first is fatigue, which there's an argument that it's linked to high job demands, but we say there are separate elements to it as well. Insecure work. Once again, you might be able to tie that into low job control, but we think they're different things.
They are different things.
Well, and the third thing is workplace surveillance as well, which can be your good old fashioned, you know, security cameras, which are in higher and higher resolution, but also, you know, computers and the type of software that get loaded on computers and phones and other things to track employees' movements and how, and that can be really invasive and cause a lot of stress.
And there's increasing evidence that there are employers, this is coming out from studies in Europe and other places, that they're using workplace surveillance, these sort of electronic surveillance systems, to then make decisions about people's futures and, you know, algorithms and bots and all sorts of things like that. So it can be very stressful and unfair. So
one of the things that you might think about is if fatigue or insecure work or workplace surveillance is an issue in your workplace, have a think about the fact it's not in the listed examples, and we'll get to it in a bit of what you can do about it.
Yeah. Okay, so the next section of the next slide, please.
Oh, sorry.
The next section is oh, you've gone too far. Okay, so what the next section of the regs say that the employer must do is identify the hazards and then control them. So the steps are, as we know with anything, identify the hazard, control it by altering the management or the work or the plants or the system of work design or the workplace environment. So you're looking at a hierarchy. Then use information instructional training. If combined with the above, must not be the predominant means of control and can only be used exclusively if none of the controls into above are reasonably practicable. And that's really important because now employers won't be able to say, oh, but I've provided mindfulness training, or I've provided, you know, an EAP that our people can go and speak to, or things like that.
Let's use mindfulness training as an example. So under 3, if the employer does provide mindfulness training, we know that if it's combined with any of the above controls, altering the management of work, plant systems of work, It must not be the predominant measure. And if it's the only thing that they use, it cannot be, it can only be used exclusively if none of the other controls listed in 2 are reasonably practicable. So they can't go straight to mindfulness training or whatever, any other instructional training. They've first got to consider all the controls that they could implement at point 2.
And I think it's important to say at this point that we know that there are certain jobs, certain sectors where there are very high levels of stress that, you know, because the stressor can't really be controlled. So you might be dealing with car accidents all the time, or you might be dealing with people who are dying or whatever. In the old days, it used to be that, oh, nothing can be done about it. But in fact, there are lots of things around that that can be done that are far removed from just providing training for employees. And the fourth really important thing here is the regulations remind the employer that there must be consultation with health and safety reps and workers. So it's great to see that they've picked that up as well.
Okay, so the third part of the legislation we want to talk about is prevention plans, which I think is a really positive initiative. So WorkSafe has looked through their data and they've identified 5 areas where they think a lot of the issues and WorkSafe complaints are coming from. So if, as part of your hazard identification, you identify a hazard that is aggression or violence, bullying, exposure to traumatic content or events, high job demands, or sexual harassment, then the employer must create a written prevention plan identifying the risk, measures to be used to control the risk, include an implementation plan, and detail the consultation undertaken. So they're these steps. So that creates a written record. It's not good enough to just say, once you a hazard identification, got to create the written record to show that you've identified it and how you're controlling it and how you consulted with HSRs in the development of the plan. It's really make a difference, I think.
Yeah, it will. Because basically, health and safety rep can say, and if you look at that list there are going to be many, many workplaces in many different types of sectors where you will be exposed. There will be incidents that relate to those things. And so you can say to the employer, well, okay, we have to do the written plan.
Exactly. I think there's one thing as well to say, we've just got to remember this is an exposure draft. Things can change. We want to add things, we want to amend some things, but employer associations, employers want to as well. Remove things. If looking down that list, if there was one thing I think that they could take out, it would be this high job demands, and it would be on the basis that, you know, it's so many workplaces have something that could be identified as high job demands, and so you know, the idea that you have to create a written prevention plan is just not valid.
So on that, this is why we're stressing that you need to, didn't mean that, we're emphasising that we'd like as many people to go in and make comment, and Dom will explain that later.
So that can be, once again, that can be talking about things that are missing, but also things that you really like.
Yeah, we love the prevention plans.
We love prevention plans, and we love the fact that high job demands is right in there amongst the other factors as well. The next and final part is reportable psychosocial complaints. So employers with over 50 staff need to provide 6 monthly written reports to WorkSafe on incidents involving aggression or violence, bullying, or sexual harassment. These reportable psychosocial complaints should be available for inspection by an inspector or HSR. I think the key thing here is they're not notifiable incidents under the Act. So a notifiable incident, when it happens, the employer has a duty to notify WorkSafe as soon as possible.
So WorkSafe can go out and check it. Yeah. So, you know, when a wall falls down or where someone gets a hand amputated, they're the types of notifiable incidents.
So, yes, we are looking at this word complaint because we think it probably narrows things down. It requires an employee to go out there and put in a complaint to their employer for it to become reportable. We'd like to, I've got a little Venn diagram there, complaints, reports, incidents. We want to make this as broad as possible. If something's happened in your workplace that involves one of those 3 factors, it should become reportable. It should go into that ledger.
And, you know, there's a concern too, as Dom said, is the emphasis on someone having to actually make the report to the employer or make the complaint to the employer. If the employer has a duty, as we know, to keep records under the Health and Safety Act, we would say, well, they should have records of this anyway. Shouldn't have to be triggered by an individual making a complaint. But we've got to still explore that.
But certainly this idea of reportable psychosocial complaints, the idea behind this is to give WorkSafe a lot of data about the type of serious hazards that are being faced by workers around these, and maybe into the future looking at including certain factors into notifiable incidents, or even just designing other types of interventions for employers. I mean, the other big thing we've got about this is over 50 staff. There's that's quite a high bar. The majority of workers in Victoria are employed by employers with under 50 staff. So we're missing a vast cohort. And I'm sure there's people on the line today who'll be saying, well, my boss has under 50 staff, this won't apply to me. And there are
arguments, yeah. I mean, the big argument, I guess, is that the government doesn't want to put too much pressure on small employers, but our argument is, well, 50 is not small. But remember that the rest of the regulations do apply to all employers. So it's just this reportable report to WorkSafe that wouldn't if it remains at 50.
So giving feedback when things are put out to public comment is a great way to see a bit of change. Now, from past experience, what we've found out is that if everyone just copies the same text and pastes it into the form, then the government's just going to look at it and say, well, that's 100 that are exactly the same, that counts as one.
Yeah.
So what we'd like you to do is have a think about, we've covered a few things, we've pointed a few things out. We'd like you to have a think about that and think about your workplace and what you can do and relate what we've talked about to your workplace and make it a bit more personalized. So it's really easy to make a submission. You go to www.engage.vic.gov.au. In that little box that says find a consultation, just search for psychological and you should be able to find the little brown box there. It should take you to that. And then there's 3 grey tabs. Click on participate. Once you click on participate, there's another couple of easy links and you'll end up in the public comment submission form. You don't have to fill in for every box. You can just write in one box or a couple of boxes. Don't get too concerned. So there you might put in the definition, for example. Yeah. Oh, I want to see fatigue in the examples under the definition. Fatigue's a really big issue in my workplace. We work long shifts, we work shift patterns that are unsociable. It's causing a lot of issue. It's causing a high rate of attrition. We really need to have fatigue's important enough. It's the biggest psychosocial hazard we have. And it's an outrage that it's not in the examples. And it's not the same as hard job demand, because I can do my job. I feel totally competent in doing my job, but it's the shift work and the hours and that's what it is. Yeah. Or alternatively, I work in a business with 40 employees, and that's the real issue that we're not contributing to the reportable psychosocial complaints, because we all know employers should be keeping a register of issues in any case, a register of IHS issues in any case. So there is an ability to publish your submission and have your name on it. There is an ability to publish your submission without your name. And you may also choose in what your feedback not to actually name your employer. You might just give an industry, for example, and then there's no way that anyone will ever, if you are concerned about it getting back to your employer, there's also an opportunity to not publish your submission at all due to confidentiality reasons as well. So it's not like when you make a public submission, it becomes public. There are ways you can do that to, one, withhold your name. And in your submission, if you don't name your employer, just name the industry. I think, there's some degree of anonymity there. And it's interesting because we've just recently had a report come back after a big consultation on workers' comp. And the people who were looking at it and the people who wrote the report, what really affected them was hearing from real workers who said, I've gone through this terrible experience. So hearing directly from workers is a fabulous way to make those people who make these decisions understand what effect it can have in the workplace. I mean, look at the process. HSRs are at the coalface. You tell your unions. The unions tells the
government.
the hall. We put it in a submission. Someone from the government reads it and summarizes and gives it to someone else who's making the decisions. Being able to come out there with your experiences from the coalface just packs that much more punch. So.
Okay, so it's really important, so please do it.
Yeah.
If you can.
Yeah, we'd encourage everyone to look at trying to, it does, as I said, it can be a couple of paragraphs.
Yes, exactly.
Okay, the final thing, well, I should say not the final thing. One of the attachments to a regs is a compliance code. Psychological health is no different. It complements the regulations. It goes into more detail. It gives practical examples. It's a great help to HSR if rather than just relying on the regulations, being able to have a compliance code there as well. It's in its early stages of drafting now, and that too will be open for public comment in mid-June, but only for a period of 2 weeks. So keep your eyes open for that one as well, but certainly your unions, employer associations, WorkSafe are in the early stages of talking about this code at the moment. And that, fingers crossed, should be out there by the end of the year is the rough time frame.
It would be interesting that if people are interested, when it does come out for public comment, I'm sure Trades Hall can run another session like this one and take people through it.
If that's what people, if that's what HSRs want, I'm sure we'll be able to do that.
Right.
Okay.
Okay, the last bit of the talk that we wanted to give is that we know that these regulations are coming, right? If everything goes according to plan, by June, we will have these regulations and employers will have to comply. Now, that doesn't mean that they can do nothing or that they should do nothing now, because as we explained, these duties have been there under Section 21 and other sections of the Act since 1985, basically. So what you as health and safety reps can do now is to be talking to your employer to say, okay, what do we have in place now? What do we need to have in place? What are we missing? Which means that you're not complying really with duties under the Act now, and be ready for the sorts of more specific duties that are going to come into place once the regs are made. So you can start looking at what are the reporting systems in place. You can start requesting information on any reported incidents or near misses, which your employer must allow you to have access to. You can talk to your designated work group members or other HSRs or delegates to get more information. So you can start building cases in order to identify any specific problems, specific sites, specific issues where you think that you've got these psychosocial hazards. You can start pushing for new risk assessments. You know, we've had a number of reports here. We haven't actually looked at that formally. You as the employer haven't done a risk assessment in years. Let's have a look at it. These must be done in consultation with HSRs. And if something comes up and you think, well, I don't want to wait till June to have this fixed, I think we can do something about it now. You can follow the issue resolution processes in the Act. You can issue PINs and you can even issue a cease work if it's that serious. Yeah. So there's lots you can be doing right now. You do that.
Shall I?
Yes.
Okay, fantastic. Right. So there are plenty of places you can go for support. The first place is your union. Great source of advice, knowledgeable people. They're there to see it from the worker's point of view. We always encourage HSRs to speak to members of your DWG. You're a health and safety representative. So you need to be talking with members of your DWG, and very often the people doing the work are the ones who've got some really great ideas on how to do things better. Reach out, other HSRs and deputies, if there are any other HSRs or deputies in your workplace or even in your industry. I know some unions have forums for HSRs across industries to come together.
Because if you're having issues, if you've identified some things, it's very likely that other HSRs, either in your workplace or in the industry, have also found the same sorts of things.
And maybe even found a resolution that works really well as well. Any union delegates at the workplace, if you have union delegates there, great people to speak to. They've put their hands up to be active in the workplace as well. VTHC and Ask Renata. You can always contact us, go through our website, ohsrep.org.au. click on the link and send a question through to Renata, who you now know is a real person.
Yeah, and when I'm not here, other people will also answer. So you don't have to wait for the days that I'm here.
You know what? I look at this slide and I think I probably should have amended it. It says even work safe.
That was me. I think I did that.
It should just say work safe. Look, WorkSafe is a great place to go as well if you really aren't getting anywhere. Just bear in mind that if you do go to WorkSafe, then your carriage of an issue is kind of limited because the inspector will come out and make decisions after hopefully having spoken to you first and then your employer and then speaking to you again.
That's right.
But we know that that sometimes doesn't happen.
Yeah.
So yeah, just when you do call in a regulator, you do lose a bit of carriage of the issue. There are still places you can do, but it's always better to try and sort it out yourself first.
Can I just add there that if you do end up calling WorkSafe and you are a little bit flabbergasted by the response that you get or how the inspector deals with things or doesn't deal with things, don't leave it. Actually contact your union or contact us and say, oh, I've got a bit of an issue with this, because inspectors are people. They also make mistakes. They sometimes are under pressure. Sometimes they do get the wrong information from the employer. And there have been times where we have assisted in trying to get things back on track. So don't just necessarily accept and of course there are ways in the Act that an inspector's decision can be also challenged. So there's all that.
I mean, WorkSafe talks about the fact that one of their pillars for the future is better support of HSRs. We need to know about the bad experiences as well as the good experiences, because there are some learning opportunities in the bad experiences for WorkSafe. And if we've got examples, we can take it to the type of forums where we can push for.
In fact, I should say that when this gets raised, when issues get raised, what we are always told is that we need to give them specifics. We can't just talk in general terms about, oh, inspectors don't talk to the reps when they get to the workplace. And so we'll give us specifics because we will follow it up.
That's right.
Yeah.
Fantastic. So look, there's a couple of links, more information and advice. We've got the ohsrep.org.au. For those interested, there's I don't know why that's there, the EBA clause library. So if you want to have a look at some occupational health and safety clauses that have appeared in various enterprise agreements for some ideas, that's always a good place to look. And there's, of course, the Union OHS Facebook group, which I encourage everyone here to follow.
Yep.
Great. That's the official presentation. I noticed there's a bunch of chat questions and I haven't even looked at a single one, but Davina, did you want to, are there any quick questions?
Yep, I'll send them through to you in the chat. Did you get them? You should have received one.
Oh yes, the first one. Does this cover workplaces that are under Comcare rather than WorkSafe? No. No, but other jurisdictions have in fact are also working on psychological health regs. And so the assumption is that there will be work done at the Work Health Safety Act level. So it will go to Commonwealth, but it may not necessarily be the same as ours. The Boland Review, which was done about work health safety laws in general, did things like recommending industrial manslaughter laws and also looking at psychological health regs. So it's on the agenda, but I don't know when that's going to happen. I think it's perhaps, look, it looks like that the WHS states under the model laws will get some kind of psychological health compliance code, some kind of guidance there. I don't think at this stage it looks like their regulations, if any, and compliance code will be quite as good for workers as the Victorians.
Yeah. But, with changes to Labor states.
Oh, that's true. I mean, true. South Australia. So just so everyone understands, one of the ways that uniform laws get changed is all the OHS ministers from the various states in the Commonwealth get together, and you need 6 votes to get agreement to change something. And it's always been quite evenly split. But now with South Australian going Labor, maybe that will alter the balance a bit, which is great for workers.
I'll let you read the question.
The next question is, should the employer have a clear mental health policy?
Look, I don't know what is in a mental health policy. You know, this is what concerns me. What the quick answer that I would give is that if you believe that your employer should have something and you believe that there are things that should go into that, well, then you can raise that and the employer must consult when developing policies and procedures. I just be very careful. Some of the mental health policies that I've seen, they're very soft. They really are about, you know, training and having, providing workers with the opportunity to join their local gym or something. So I would rather see a negotiation with the employer in terms of what they're going to do to comply with what has to happen in the regs. And then I'd look at whether there's a policy.
If the employer does have a mental health policy and they're going to point to that, it should be reviewed in light of the when the regulations do come in to make sure that it is actually compliant.
Yeah.
If they're going to hold it up and say this proves that we're compliant with the regs, it needs to be looked at to make sure that that is actually the case. The next question is, what about smaller groups, less than 50 staff? Okay, just to explain, we went through 4 sections of the Act. The only thing that regs. Yeah. There are only four sections of the regs. There's only one that doesn't apply to smaller work groups.
Well, that they're proposing won't apply to 50 or less.
Which is the psychological complaints, reportable psychological complaints. If you've got less than 50 staff, you don't have to report into WorkSafe every 6 months with every reportable psychological complaint that's been made in the last 6 months. All the other bits of the regs apply to all employees.
The written plans apply to everyone.
Yeah.
So, but this is why we've said we are going to challenge the 50, because one of the other things that I would hope that WorkSafe would do is, say if I get, you know, I'm the person at WorkSafe that gets these reports and I have to go through them, and I keep seeing Acme manufacturers, 50 reports, 70 reports, 90 complaints. Then I'd be ringing up the inspectorate and saying, you need to go out and do a visit there, because Acme Manufacturing is a really bad employer. So this is why we want to see more employers captured by that. But as Dom said, it's only that section of the regs that wouldn't apply at the moment for under 50.
The next question literally explains my concern in a much more succinct way than I was actually able to do it. It says, I work in an organisation where all staff have access to the incident reporting systems and very often report incidents of aggressive clients. Would this constitute a complaint, or would it be the formal HSR process of registering a complaint? That's exactly the issue with using the word complaint in the regulations. And that's exactly why we want to give feedback to say simply using the word complaint is too narrow. We want to capture lots of things under this: reportable incidents, reportable complaints, reportable reports, even though that's a useless double up. So yes, that's a really great question.
Can we capture that?
Can we capture it? We've got it. We'll be able to get all the comment logs. Yeah. And shouldn't we be looking, next question is, shouldn't we be looking to identify any environmental management concerns where these events could occur? Not entirely sure I understand that question. I mean, just going.
Oh, you mean perhaps the reportable is.
I can talk to that.
Yeah.
If that's okay.
Yeah, go on.
Well, really, if we're just all the examples we had, they're actually consequences. So we're sort of waiting for something to happen. We need to look at why they might, and at what point in time they could happen. Just like if there's an unguarded chain, someone could put their hand in it.
Yeah, so those examples, I mean, what it is that if you look at the definition, it actually says that the definition is now I've lost it. Is any factor in any of those things that may cause a psychological response in someone. And the examples there actually point out what some of those things might be. These are,
so they're consequences.
Psychosocial hazards. They're not
hazards, they're consequences.
No, they're not consequences. Low job control is not a low consequence of, that's actually the hazard. as is bullying. I mean, the consequence of bullying,
not a hazard.
the consequence of bullying is a stressed, damaged person. The hazard is that there is bullying in the workplace. The hazard is that there is low job clarity. The hazard
Isn't the hazard is that there's an environment where bullying can happen? Oh,
That's ominous.
Well, but that's too broad. I mean, what you're doing is what the regs are saying is identify where these things could occur. So these are the hazards. The consequences are the consequences on the person that cause the psychological injury. So by identifying these things, bullying is probably a difficult one to look at. But if you look at some of the others, it's clearer. If there's a workplace that has high job demands, which means that people aren't coping with them, the consequence is that those people will be psychologically damaged, will have mental health injuries, right?
Yep, get that one.
Yeah. So
Yep.
bullying is a
Can
little
I?
bit.
Yep.
Go on, well, I think we better move
It's all right. I teach stuff in work health and safety all the time. I get this sort of thing, Tracy, a lot. And so what you're exploring and what you're picking up on are some of the systemic underpinning or underlying causes, as well as immediate causes of the impact of the hazard on the human, which is what Renata's talking about.
Yeah, I think
Thank
once
you.
again, the compliance code
Thanks,
will make
Patricia.
that a lot clearer. This is the hazard, this is the definition, description of the hazard, and these are examples of the hazard.
And then if the hazard is not eliminated or minimized, these are the consequences on workers.
Yeah.
So, yeah.
Aggression or violence, definition, conduct which exposes an employee to abuse, the threat of harm or actual harm and causes fear. Examples include verbal or physical assault, being bitten, spat at, scratched, being threatened with or without a weapon, verbal abuse through the phone, robbery.
So then when you look at what the controls would be, you wouldn't say, well, and this is what happens in many industries. And in fact, this is what some of the health and safety reps were telling me at the RTVU. Oh, there shouldn't be any incidents because we'll train you how to de-escalate. And we say, well, hang on a minute. What about looking at the system of the work or the workplace itself to protect workers from being abused or physically attacked or spat at or whatever? So you're actually looking at the higher end controls, not the lower end of we're going to teach you how to de-escalate so that there won't be an incident.
Quick question, de-escalation training, is it better or worse than mindfulness training?
I don't know. I'd say better maybe, but I don't know. Okay, next question.
I think that's every, where did you get that example from? Is it from the regs? Michelle, I can't answer that question.
Yes,
Oh yeah, okay, no, that was an example from a very early draft of the compliance code, and that was just an example of what the compliance code will do for each hazard.
Which is why it's important for us to have the extra examples in there.
Yeah.
Because it explores them more. It gives, and you've got to remember too that in Victoria, we're lucky that we have compliance codes, unlike the other jurisdictions, because compliance codes set out clearly what WorkSafe and the government believe the employer needs to do in order to comply with the duties under the regs or the Act. It's not just shoulds, which is what codes of practice say under the other jurisdictions.
That's one of the things that we have to do. All the shoulds that they put in the compliance codes.
I keep crossing them out going, needs to.
Needs to or must. Okay, fantastic. Look, I think that's all the questions. If anyone does think of anything in the next little while, feel free to reach out to your union or to ask through Ask Renata portal as well,
yep.
Which you'll find on our website. And finally, I would encourage everyone who does have a personal story about some of the things that we've talking about, please feel free to go out there and make a submission. The real workers' voices is really what's going to change opinions.
Yeah. And can I say, if you're unsure about what you want to put in, talk to your union, even send an email into here. Say, does this sound okay if you're really hesitant? But, you guys face it all the time. You know what the issues are in your workplace. You know what needs to be looked at. You know what needs to be in the regs. So go ahead and do it.
Fantastic. Thank you very much, everyone. I hope I've seen a few chat. Hope everyone got something out of this, and we'll speak to you all soon.
Bye.
Thank you.